start on both platforms. Hello, Instagram and hello, Facebook. We're waiting for Facebook to go live. So, we are about to talk about how you can use patient anecdotes. Yes, how you can use patient anecdotes to improve your personal statements. This, of course, is a topic that is very near and very dear to my heart, the use of anecdotes for your personal statements. Hi, Camilla. So very close, very near and dear to my heart. So we're going to jump into it. If you've never been on one of my lives before, if you've never been here before, my name is Shauna K. Lester, and I am the founder of Memorable Essay. I'm also the creator of the IMG Residency Match Application Accelerator, which is a premium program in which I help ambitious international medical graduates to create Brittany, to create applications that stand out. So if you see me looking both ways, it's because we have Instagram and Facebook going at the same time, and we're going to make it work. So to jump into the topic, the introduction to this and what I have described, it talks about the fact that at this stage in your application journey, your personal statement remains what you have complete control over, right? So there are other things like your performance in medical school, there are other things like your performance on the STEP exams that are already through the window, but this remains a domain that you have full control over. So how do you make a personal statement stand out? One of the big ways to do that, one of the easiest ways to do that, so easy, is to include an anecdote, a patient story, right? Specifically, so there are the anecdotes from your life. There are those, but then there are also, as in your personal life, there are also the professional anecdotes, so the ones from patient encounters. And those are some of the best ones to include. And so we're going to talk now about how you can include those patient anecdotes to basically improve the quality of your residency personal statement. What are some of the things that you have to think about? So the first consideration when you're deciding on the patient anecdote to choose is what is the overall message or point of your personal statement. So your personal statement will have a main message, it will have a point. So if you say to yourself that now you're going to select a patient anecdote, this patient anecdote needs to help you to drive home the point of your personal statement. So for instance, it's like if you were going to purchase a belt or purchase a pair of shoes, you would have to choose something that goes with supporting the outfit. You can think of it like that. The message that you want to communicate about yourself and about your desire to pursue residency training needs to be supported by the patient anecdote. So as you think about all the stories that you can tell, think about which of those stories is going to say what you want your overall application to say. If you want your overall application to say, this is a young physician who is dedicated to no end to the practice of pediatrics, you will, of course, then be picking a personal statement that shows that you're a young physician who's dedicated to no end to the practice of pediatrics, all right? Okay, this one is a really big one. Step 2. You want to think about which of your patient encounters were so meaningful to you that it changed you in terms of it changed how you saw the actual specialty that you're looking to match into and how you saw yourself in that specialty, playing a role in that specialty. And the reason that this is so important is because it's really easy for someone to pick a patient anecdote that was like, oh, this was intellectually interesting. I had to go and look up something in a journal, or I had to spend a bunch of time with the senior resident, going over my list of, differential diagnoses or whatever. Anybody can pick something like that. But when you think of the things that affect us most in life, they are really the things that change how we see ourselves and how we see ourselves in the world, right? So let's say, for instance, one of the clients I'm working with now, without giving away her story 100%, she is applying to pediatrics, and she had a patient encounter that was so meaningful that it has made her so committed to practicing in this specialty that it is not a joke. The incident changed her at a very, I don't even know what is the word, but it wasn't cerebral, it was here, right? Like the change didn't happen here as in, oh, this is so interesting. The change happened in here. It happened in her gut, like, oh my goodness, I need to jump in the ring. I need to do something to produce a difference in this field. And that's the kind of patient anecdote that you want to choose. Something that really showed you something different, that changed how you thought about the specialty itself and how you saw yourself showing up in that specialty right now and in the future, right? So the other benefit, which I wanted to talk about, is the other benefit of choosing an anecdote that really portrays an incident that changed you very deeply internally and changed your mind about something, changed your commitment to something or your desire to pursue something, is that when you then go for an interview and should that anecdote come up, it will be such a different conversation from people who have chosen these anecdotes that were just more cerebral, interesting, made me think I could do this. Because the conversations that we have about things that are extremely meaningful to us, thanks guys, the conversations that we have about things that are deeply meaningful to us are very different from surface conversations. And the people who are conversing with us, they can tell. So I can tell from somebody's body language, by movements in their face, by what their eyes do. Like sometimes you can tell they're actually really recalling that patient or, remembering how they felt in that moment. Those sorts of interviews are extremely rich because people can see that you're genuine. They can see that this is not a patient case that you Googled, right, and grabbed from somewhere and said, oh, this one sounds difficult. This one is difficult to diagnose. Me, I will make this my encounter or my anecdote. It shows that it's not something like that, but it really is something very real. And you prepare yourself to have that level of honest, deep conversation based on what you chose at the very beginning. So please make sure when you're choosing the anecdote to choose something that really changed you internally in terms of how you saw the specialty and how you see yourself showing up in this specialty. The other thing which is super important, and this takes a bit of skill or a bit of finessing, so what? This takes a bit of skill, but you really want to choose an anecdote that shows you, the person, in a good light, but without you having to explicitly say, oh, here I am in a good light. I'm so amazing. How do you do that? The way that you do that is that the anecdote is going to be explicitly about the patient, right? So you're sharing the story of whatever this person presented with clinically, or like them and family members, how you resolved it, how your team resolved it. But if you make a really good selection, this anecdote can implicitly tell stories about you. So let's say, for instance, the case that you choose or the patient anecdote that you choose, it's something that has to do with you having to go above and beyond for the patient. Then that shows that you're the kind of physician who goes above and beyond for your patients. Let's say you choose an anecdote that shows, and notice that I'm using the word shows, I'm not using the word says or tells, right? Let's say you choose an anecdote that shows that you as a physician, whenever you don't understand something, as a young physician, you go home, you look it up, you ask further questions, you do further reading, you might even, do a case report on it. And that's something you're able to mention that shows us like, oh, well, this is somebody who's curious. If they don't know the answer, they push further. In selecting your anecdotes, you want to choose something that is interesting in terms of like clinically interesting, but then it also should show you in a good light without you having to explicitly explain how you are. Another example of that would be something like, let's say, again, I think pediatrics is already an example. I think psychiatry is another really good example of this as well. Let's say that let's choose psychiatry since we've been talking about pediatrics. Let's say that you get a patient who requires for you to do a ton of liaising with social services. So maybe with a social worker, maybe with a church. That could also be like family medicine. Sometimes you have family medicine patients who are taking care of individuals who have psychiatric conditions. So there's some sort of overlap. And then in the anecdote, after talking about the patient, you're able to share with us how the case was resolved, or the change that you made with the social work team, or the connections that you made by counseling the wife or counseling the husband, or also, bringing in the child. Then without saying, oh, look, I'm so amazing. I go above and beyond. I get the whole family involved. I, call child services as many times as I need to. You are showing us that, and we can infer from that all of these other things in addition to learning about the patient. So that's another really good thing to focus on when you're choosing your anecdotes. One, that brings us into the clinical setting so we can see how you are, but with the patient, implicitly, but one that's also explicitly talking about the patient at the same time. The last thing that you need to consider, and I'm laughing because this is hilarious, because this is how you can always tell the people who are Googling their patient anecdotes and just picking it and copying and pasting it and putting it in their personal statement. Can you tell this personal statement in a way that is specific? And then can you have a believable conversation about the patient in a way that is specific? So let's say, for instance, you're saying, encountered a patient, diabetic foot, needed extra counseling in order to get the person to, I don't know, agree to an amputation or something. It's very different if you pull that story or you try to tell that story, but there's no age for the patient. There is no occupation for the patient. So we don't know, for instance, that the patient might have been very attached to her foot or to her leg, his foot, her leg, because of the kind of work that they were doing, because of their home situation. It is less believable because the people who are reading your application, beyond me or some other consultant, I'm talking about the program directors, whoever, who've been doing this for their entire life and a half, they can easily see through people who are lying, right? And one of the easiest ways to tell whether or not somebody's lying is whether or not they can get specific with their details. So you want to choose a patient anecdote that you remember the details or you can easily access the details, as I'm saying, such as age of the patient, how they presented, what they wore, what was their affect when they came in to see you for the first time. All of these things are very powerful in storytelling, but they also just make you more believable. Another thing that's really important about specifics when you're giving a patient anecdote, as we were just talking about showing yourself in a positive light, is that we are able to ascertain from that, we are able to deduce from that, that you are somebody who actually pays attention to specifics, who actually pays attention to detail. So let's say, for instance, I think I can talk about this one because it was last year, somebody wrote about an individual who would come in to see her in the family practice, and she was always, like sweating, the hair in a certain direction, and she'd come in and she'd ask for her just to rewrite the prescription so she could leave, right? But upon investigating, upon pushing this person, the patient had all of these responsibilities at home that made her rush through her visits, that made her not compliant, that made her always fall behind. But in writing that patient anecdote, the person who was writing it, she was able to get so specific because she actually was paying attention to this woman. So she actually remembered the time of day she would come in, how she would be attired, how she would be sweating, how she would just present in such a horrid way. And in writing about the patient with that amount of detail, to be clear, not useless detail, not useless specificities, but meaningful specificities, it was clear that she is somebody who pays attention. By the time she was done talking about that, you had the feeling as the reader, I would love for this person to see me. I would love for my physician to notice the expression on my face, that it's not the usual one, or to notice how I'm sweating, or to notice how I'm upset when I talk about my son or my daughter. So you really want to choose one of those anecdotes that have specifics. So to recap, when you are preparing your personal statement for residency, it needs to be memorable, you're an IMG, it needs to be excellent, you're not playing games, right? Okay, you're coming to match. So everything needs to be excellent. A part of producing a personal statement that is excellent is to leverage the power of the patient anecdote, but you don't want to choose just any anecdote. So to recap, you're choosing an anecdote that supports the overall main message of your personal statement because, why would you do anything else? So whatever is that main message, the patient anecdote that you choose needs to support it, very strongly. You want to choose a patient anecdote, if you can, that really changed you, meaningfully internally from, like I'm saying, from your gut. It made you see the specialty differently. It made you see yourself and your future self in the specialty very differently, and not just something that was, cerebrally, that was really, interesting or so on. And this is important, again, because when you get to the stage of interviewing, the things that you care about or the things that you authentically were changed by make for very interesting, conversations at sort of like this guttural level. You want to choose patient anecdotes that while they focus on the patient and they are mainly about the patient, they also implicitly paint you in a good light. So maybe a patient anecdote, a patient encounter that required you to go above and beyond what you normally would do, whether that is in helping them, in supporting them, in helping them to be compliant with their treatment plan, whether that's something that required you to come early and leave late because of how that particular clinic or that particular hospital was staffed. You are not explicitly drawing attention to yourself, but you're choosing an anecdote that does implicitly communicate, that you're a good team player, that you communicate well, that you're flexible, those sorts of things. You want to go ahead and choose an anecdote like that. And you also want to choose a patient anecdote that you can be specific about because you actually remember it, or you can, access the details about it and then remember it. Or it just shows, it just shows, in addition to helping us believe it, as the reader, it shows that you are somebody who pays attention to specifics, to the little things, to, unanswered questions or one word responses that a patient might give or so on, and what that means about them. So I hope that this was helpful for you. And so if you learned nothing else, please make sure that there is a patient anecdote in your personal statement. And if you choose to include one, you know some of the things that you can look at in terms of choosing which one, because you have so many. All right, take care.